Hey guys, just bear with me here. It looks like we're still having some problems with our Instagram login. But looks like we're good on LinkedIn, Facebook, YouTube, Twitch. Daily Motion's good. Twitter's good. And we should be coming live now onto Facebook. Onto Instagram. Perfect. All right. So, hey guys, welcome to the CPD Junkie podcast, where we bring you interviews with dentists sharing their CPD stories and journeys from around Australia. What better way to learn than to follow those who've already done it before? CPD Junkie is Australia's most comprehensive CPD, so head over to cpdjunkie.com.au and become a member for free to access the full features of the site. I'm your host, Laurence Doan, and tonight we are joined by Dr. Leo Lander. Dr. Leo Lander has been practicing dentistry overseas for a decade. The last 2 years was being in Oral MaxilloFacial Surgery before relocating to the Southern Hemisphere. Then he moved to Dunedin, New Zealand in the early 2014 to undertake specialist training at the University of Otago in the field of Periodontology. Upon graduation in 2016, Leo has been practicing the full scope of Periodontics and Implantology in Adelaide, South Australia. Dr. Leo Lander, welcome to the show.
Hello.
So, you specialize in perio, but that wasn't always the case. So tell us about your CPD journey so far.
Well, to be honest, when I was a dental student, I always thought that I'm not going to specialize. So, because I thought it would kind of limit my scope of practice. And I never actually had fun doing perio at the dental school, and I actually loved endo. But things change, people change. Right now, I would rather poke myself in the eye with a K-file than do an endo. And I love what endodontists do. They preserve people's teeth until they can save up for the implant. But we change, we evolve. So when I was doing my dental school, I was on a military scholarship. So I had to give some of the time back to the military. So after graduating, I was an army dentist for a while, which was interesting. I mean, you're kind of, I was stationed for like 3 years in infantry base. So you kind of learn to operate on your own and kind of try stuff that you probably wouldn't try if you had support, but you don't have it. So kind of similar to being like really, really rural in Australian terms. And then I got accepted into next step training program. But after doing 2 years of that, of not having a life, we decided to move to New Zealand and do perio. So that's pretty much how I ended up kind of going into different places on the globe. And then after finishing perio, ended up in Australia.
Well, let's slow it down a little bit. So you graduate in 2005, is that right?
Yes.
And then you work as you work as an army dentist. Is that because similar to what we have in Australia here, you have to, they sponsor you, and then so you have to give back a few years?
Well, basically, it was back in Israel. So in Israel, military service is compulsory for both boys and girls. So my wife did her military service in the Navy. Now, if you, so basically it's, back at the time it was 3 years for boys, 2 years for girls, compulsory service. But if you want to kind of go into university straight out of high school, if you get accepted, they will pay you. They will pay the tuition for the uni. The army will pay some kind of a allowance. But then at the end of the day, on top of the 3 years that you originally had, no matter what, you need to do another 2 years because you got this deferral. And you started for the army. So
Right.
yeah.
So when you're working in the army, and you know, in our situation here, you can still go to CPD courses. Did you take any CPD during that time? Because you mentioned you were interested in endodontics, but you ended up in oral surgery.
Well, you know, first of all, Army does organize some CPD on their own behalf. So basically, you can get like either like some kind of internship or ask for permission like once a month to go and assist and observe a specialist working. So I actually did observe some oral surgeons. So because basically I kind of understood that endo is not my thing. Even though I could do like you know, back in the day, it was like almost 15 years ago in the military clinics in remote areas who didn't have rotary instruments like hand-files. I could do a molar endo start to finish, including the core build up in 2 hours. I didn't really like it. If I saw endo on my schedule, I was, oh my god, I was endo. So I did get to observe oral surgeons, and it was cool. So I liked that. And I had to do a little bit of, I mean, when you're in the army, you have mainly a young population, and then you have all those people that come from unprivileged levels of society. So they have like broken down teeth that need to be removed, and people that have periodontitis. And it's the age group, right? So you deal with a lot of wisdom teeth. So you kind of learn that.
Right, so you were interested in endo, but once you actually got more into it and doing it on a daily, you realize you don't actually have an interest for it. And at the same time, you've got the army's giving you training and internship, so you're dabbling in different... Are you having a rotation at different specialties? Is that what happens? Or you're attending courses?
You kind of, after work, I mean, you know, university is really different to the real life afterwards. So whatever you get to experience at the uni, it's not the same pace and it's not the same environment once you go out, regardless of whether it's public, military, or private. So after working for a while on your own, you kind of get the gist of what you actually like doing on a more routine basis and what you don't like doing. What gives you more satisfaction, what gives you less satisfaction. So at the end of the day, you decide what you would like to improve your knowledge at or get better at. And then you ask your superiors to allow you to kind of expand your knowledge in that field. So you would ask them to kind of once a month come and observe a surgeon doing like
Sure.
instructions and stuff.
Yeah, so then you realize you have an interest in oral surgery or oral maxillofacial surgeon. You'd specialize in it, right? And from us, for general dentists in Australia, that's like a lot of work. You have to go through a medical and then a dental kind of program.
Well, in Israel, you don't have to do medical. So it's only a dental specialty. So you have to do 5 years of training. And this is quite intense. So if you're having like if you're doing a night shift, basically you're doing a 28-hour shift. So you start at 7 a.m. Then you're kind of working either in the theater or the outpatient clinic hospital. Then the clinic finishes at like, I don't know, 4 o'clock, 5 o'clock in the afternoon. Then you stay for the whole night in the hospital. So basically you deal with all the trauma and cases afterwards, infections, whatever. And then in the morning, you still have to kind of finish up whatever you started doing during the night. And then you can go home at about 11 o'clock if you're done with that stuff, to come back the next day at 7 a.m.
Wow.
So crazy hours.
Yeah. So, I mean, because you have an MBA as well, and did you get it at the same time as when you did your?
I did that during my military service. So basically, when you're stationed in a remote base, you kind of start, well, you start your week at uh, kind of Monday afternoon, and then you kind of finished Friday morning or even Thursday midday. So basically, there's not much to do on the base when you go home, and it ends up that you have like 3 days worth of weekend. And for the first few months after uni, it's fun because you get to play your PlayStation and chill. But then it becomes really boring because at the end of the day, you're not doing a lot of comprehensive stuff. You're doing like basic stuff because fillings, root canals, extractions, fillings, root canals, extractions, and you kind of become dumbed down. So you need to have your brain cells working. So my way of doing that is signing up for an MBA program, and one of the university was providing this program free of charge for military personnel. So I basically got my MBA degree for free. It was run during the weekends for 2 years. So it was fun. I mean, getting exposed to other things and started thinking in more of a understanding things from the business point of view. Because like being a dentist doesn't really mean it's going to be business.
Yeah.
Sometimes it's contract.
So yeah, so you've taken this MBA, but people would, and you say you wanted because you wanted a better business literacy, financial understanding, and because you've had the spare time. I mean, do you actually feel it helped? A lot of people say when it comes to business, it doesn't really help. Particularly if it's dentally related. Do you find that the MBA was applicable in our dental environment?
Yes, it helped me not buy a practice. So my first year in private practice, after I finished my period training, my boss wanted to replace practice. It was kind of nearing retirement age. So, but when you do have some kind of business degree, you can actually read the financial stuff provided by the selling party. So you don't really need some special advice from other accountants or lawyers or whatever. That you don't understand them. But the sheer ability to read financial reports made me realize that what the deal is being offered to me is far from being great. So I kind of politely walked away. In that point, and then a year later, COVID happened. So I would be stuck with a huge loan and having not to work for a while, for a few months. That would have probably killed me financially.
Yeah, I mean, it is an interesting times, isn't it? So, in today's age, where there's so many kind of business courses out there and videos out there, would you think that for a graduate who might be interested in thinking, I can probably do an MBA and now understand it more, would you say you actually don't need it, like you've just mentioned? Yeah.
Well, it did help me not make a big mistake, financially speaking. So it was useful to an extent, and I mean, I did have fun doing it, the program, and it did exercise my brain so it doesn't get dead during the army service. So there's not too many negatives to it. So I really enjoyed it. So if people are keen to actually learn and improve their skills, not necessarily in dentistry. I mean, we can we can have different scopes of interest. And that could be one of them. I mean, the CPD doesn't have to be necessarily in your professional field. You can develop yourself as a person. And that's not less important than getting better at what you do professionally.
All right, so let's get into the perio. So you're an oral maxillofacial surgeon, but then you come to New Zealand to do perio. You know,
First of all, I'm not a maxillofacial surgeon because I didn't finish the program. I quit after 3 years. So I don't want to sound like I have a degree that I don't have. So yeah, it was a shift of thinking. So when you come from surgery to perio, you're like a pendulum. You just go from one side to the other. Because when you're a surgeon, if you see a tooth with an 8 mm pocket and a little bit of mobility, you don't really think twice. You numb it up, grab your forceps, and the tooth comes out in 2 seconds. While in perio, you kind of, wow, there are so many teeth that I could have not extracted and actually kept for many, many years. So I kind of swung to the other side and trying to save everything possible, even the hopeless stuff. But then you find some kind of middle ground in my second year, probably. So kind of differentiate what teeth are worth fighting for and what the patient would actually be better off without.
Right. So, whilst your focus is in perio and implants, you still do wisdom teeth removals, do you think that can be kind of confusing for the referring dentist that might be sending it to you?
No, I don't think so. Well, first of all, it's fun. I like it. Second thing is that people that refer to me, they know my scope of practice. So, I mean, it's not like they're going to send me a patient for one thing and they will get something completely different. So yes, I also get referrals for wisdom teeth, and it's not like I'm practicing out of my scope of practice. I just expand my scope of practice, not only to perio but to other things as well. And in Australia we're also registered both as specialist general dentist, and everything in general dentistry is in the scope of practice. The thing is that when I do perio, and sometimes people with very bad caries condition, wisdom teeth could be in the way of proper maintenance. And if I do perio in quadrants, or actually I do 2 quadrants at a time, half mouth each time, I tell the patient that some teeth, or say like the wisdom teeth in my case, they probably would be better off without them. And while we're numbing them up for half of their face, might just as well use that
opportunity. Yeah,
to remove those wisdom teeth at the same time. And I think it works for the benefit of the patient. It's not like I'm doing a couple of MOs and DOs and patient at the same time. But it's still within the scope of practice. My referrers know that. And I do have a couple of referrers that they write in their referrals, if you think that something might need to be removed, please send the patient back to us to do that. And that's fine. I respect everything that I get, because basically without my referrers, I wouldn't be able to provide for my family.
Understandable.
So, if they want to do the referral, the extraction, this is perfectly fine. If they don't mind me doing that as part of the perio treatment, that is also fine. So I'm trying not to step on anyone's toes while still providing the best possible patient.
So you're a clinical surgical tutor for programs, and you hold your own CPD training courses as well. how do you suggest a participant kind of makes the most out of the CPD that they are attending?
I think the best way to make the most of attending a course is actually choose your courses wisely. And what I mean by that is not choosing something that sounds cool and you've seen awesome Facebook images of certain surgeries or whatever, makeovers, but something that you actually are ready to implement, which would you think that you would consider them to be your next step in your evolution as a clinician. So, you know, if you've only done like if you're a new graduate and you've only done like a couple of single unit crowns during a course on full mouth rehab with total bridges from like 7 to 7, while you're gonna have fun doing the course, because you'll be like, whoa, this is amazing, this is unbelievable. But at the end of the day, are you gonna do any of that the following Monday when you come to your practice? Unlikely, because you've got someone else's philosophy and knowledge, but your experience so far hasn't prepared you to take that next step. Does it make sense?
Yeah.
So even though some things sound really fun and awesome and you would like to get there eventually, you just need to choose your courses, your CPD, according to the level that you're at the current point, and matching to what you would actually want to do just tomorrow, Monday. And that way, you will see, while you're doing the course, you're kind of listening to the lecture, to the presenter, and you think, oh, this is a nice thing. I should try. I should have tried that on the patient that I saw last week. No? And the other thing to understand is that not everything that you hear in a course has to be immediately implemented. So if you get several bullet points out of a course, and it makes you change the way you operate or make you a better clinician, that's totally worth it.
Yeah. I think you touched on so many good points there. I think what you said is, you know, pick courses based around the things that you will be able to implement back at your clinic. So, or maybe what your clinic is doing, and then build on that. And then the other thing is, like you've said, is I've slipped ahead of me right now, is when you're picking these courses, you don't have to use it straight away, but as long as you're building on it slowly over time, it's good. And there was that one more point that you were just saying, it's just slipped me right now. It was, what was it? You might have to prompt me. It was that middle point. That was a really good point there. It was like, oh yes, I remember now. It's like when
listening comprehension.
no. I think it's an interesting point. This point, it's that you have to have some basis of understanding to really apply what you're learning. So, you know, when you're learning about implants and whatnot, but if you're not really learning a little bit about it along the way, you might not really understand it. It just might just hit you, and then that's it.
Learning has to be incremental. So you learn to walk before you start running. That's the way it is.
So I'm going to talk about perio as well here. So perio is an interesting topic, especially when it comes to dentists, oral, OHTs, hygienists. Some perio believe that dental graduates aren't taught enough depth with perio at uni compared to their OHT counterparts. Sorry?
I think all of the dental students are not being taught proper perio, and there are a few issues with that. And by the way, I actually think that neither do OHTs, because OHT is a very interesting degree. I mean, we have it in Australia and New Zealand, but you don't see it in other parts of the world. So is a hygiene training, which is hard enough, you know. So when OHTs do their 3 years of training, I don't think they get enough of either. But that's my personal opinion, comparing to things that I've seen in other parts of the world. Now, in dentistry, in dental schools, first of all, we have a shortage of teaching staff. So at the end of the day, we get to the situation where hygienists, well, very experienced hygienists, they teach and supervise the dental students for perio. You know, it's kind of, I'm not trying to put anyone down, right? But it doesn't kind of seem right to me. The other thing is, in dental school, students are not interested in perio. And I wasn't interested in perio, to be honest, myself, because at the end of the day, in dental school, we are mostly caring about, or not caring about, but kind of driven by more immediate or instant satisfaction. So you have a hole in the tooth, you do a filling, and then, bam, the tooth is nothing nice. Okay. You have a broken down tooth, you take the elevator and the forceps, 5 minutes later, or if you're students, 45 minutes later, the tooth is out, ta-da. In perio, you do stuff without seeing it, because it's sub-gingival, right? So you don't see what you do. You don't know whether you do it right. And then, in order to see any kind of results, you need to wait for about 3 months for the first reevaluation. And then, by the end of the 3 months, you have the summer break or the midwinter break, or you graduate, and you know, so a lot of things are falling in between the cracks. And at the end of the day, the students come out without understanding, and I'm not even talking about doing perio in clinical practice, but understanding how to do it or the principles of it. And this is a problem of the system. I'm not saying that anyone is they're just kind of letting it down, but the system is just designed that way, so we just don't get the students enough study. And it is fundamental, because at the end of the day, we can do a beautiful crown, but if the tooth has lost 80% of the bone support, it's going to find itself in the bin eventually.
Yeah, no, I hear what you're saying. Do you think that there would be any CPD that, you know, people might not benefit, that you've not benefited from in your time?
I think the stuff that I've done that I haven't benefited from is cosmetic injections. I did the course probably like, I don't know, 10 years ago, and I haven't used that. Never done that outside of the course. So, you know,
Fair enough.
I planned to do it, but eventually I didn't do it. And then when I started training in maxillary surgery, I didn't have time to sleep, not to do any cosmetic work. So, yeah, I mean, not every course that we take, we're going to find ourselves doing that. So, yes, I guess it was a bit of lost money, because I'm not planning to start doing cosmetic injections. But, you know, at that time, I thought it would be a good investment, and it turned out not to be a good investment. And basically, if you think about it, CPD is our investment in our own development, right? But with any kind of investment, there is no investment tool that provides you guaranteed return. There is always some risk you're going to lose, right? Any type of investment. So, yeah, some of the courses are a bad investment. Not because the course is bad, but because your plans didn't, the stars didn't align a certain way, and you ended up not doing whatever you learned.
Yeah, you couldn't implement it.
Yeah.
So over your career, has there been any particular big influences?
In terms of CPD,
Yeah.
I think in terms of CPD, and especially for a new grad, the most important one would be communication skills. Because at the end of the day, our training is all about manual dexterity. They don't teach us how to talk to people. And one of my professors at the dental school, when I was still a dental student, said that patients, they don't know dentistry. They can only tell 3 things about their dentist: whether they're quick or slow, whether they are, whether it hurt or didn't hurt, and whether they're a nice person or not a nice person. And neither of those 3 have anything to do with the quality of the services you provide, as in terms of clinical dentistry. So, you could do a perfect, beautiful restoration, but it took you longer to numb the patient up. So it took a long time, and it hurt. You're getting close to the pulse. Did it mean that you had did a bad job? No, you put a beautiful lining and whatever you put underneath the filling. I don't remember the name of it. And then do your filling.
Etch bond, primer.
And at the end of the day, the patient might walk out unhappy because, even though you did a perfectly good clinical job. Now, even when you're a specialist and you know your trade and you know what to do, you don't get to do it if the patient, after seeing you for a consult, doesn't make an appointment with it. And it comes down to communication. And when I started the first year out, I was on a salary, and my boss was like, "You know what? I don't care how much you charge for the treatment. As long as there's a bum in the chair, I'm happy." So, and people, probably half of the patients that I would see for consult, they wouldn't schedule for treatment. And after doing some communication training, I now charge probably more than twice than I used to charge as a new grad for period debridement, and probably more than 9 out of 10 they schedule for treatment. So it's a matter of how you present and communicate with the patient, and the wording that you use to provide your information. That makes a lot of difference to the patient. And that, at the end of the day, it makes a lot of difference to your bottom line, because you need to do treatment to actually provide for your.
Yeah.
So, communication comes first, because if you're a great operator, if people don't want to see you because you're not nice to them, or you've been abrupt or whatever, as good as you are clinically, you won't have people to implement your clinical skills on,
Yeah. Have there been any particular struggles in your CPD or dental journey so far that some of our viewers might not have known about?
Struggles in the CPD journey, well...
Whether it be dental or CPD related.
Well, I think once the communication thing was kind of done and dusted, it was relatively smooth ride. And once again, kind of matching the CPD you want to take to your expectations about your next step and your evolution as a clinician, even as a specialist. So there are always better clinicians than you are teaching more advanced procedures and better skills. So you kind of gradually increase your scope of practice and learning more and doing more. So the incremental learning, it never stops. It just kind of always push to the next level.
Mm. You mentioned before our chat just then that, you know, when you moved to study in specialty, you know, it was a difficult time. Your wife was working and you were studying. Could you talk a little bit more about that?
Well, when I was doing my surgical training, I was probably, I wouldn't lie if I said that I worked probably anywhere between 80 to 100 hours a week. And that was crazy. I mean, I was doing that, and at the same time, my wife was working in the same hospital as a nurse in intensive care, and we didn't see each other, to be honest. I'm not even sure how we managed to have a third child, but we didn't actually meet up. Or I was so sweet I just don't remember that. So at the end of the day, we just had no life. And then I decided, okay, so if I don't want to continue max fax, and if we want to move to another country, being max fax, you need to have a medical degree on top of your medical degree. Sorry, a medical degree on top of a dental degree. So I was like, okay, so what's closest to surgery, but not surgery? I thought, okay, that's probably perio. So I applied. I basically just Googled the email addresses of heads of perio programs in Australia. And when you live on the other side of the globe, when you say Australia and New Zealand kind of works together, you don't realize that those are completely separate countries, like a few thousand miles apart. It goes in the same sentence, Australia and New Zealand. And I was like, okay, maybe I'll just write to New Zealand as well, might just as well. And I got accepted into Griffith Uni to do perio with Prof. Sasha Ivanovsky. It was actually funny when I was doing my interview over Skype. It was like 3 a.m. back in Israel. So I was sitting in front of my computer with my shirt and tie and whatever, and undies underneath. So I got accepted at Griffith Uni, and then sent me an email saying, "Congratulations, we're happy to offer you a place. Please pay your $48,000 tuition per year." And then I got an email from New Zealand saying that it was Professor Warwick Duncan. I've looked at your credentials and whatever, and it looks like you have a good chance of getting a scholarship. And I didn't even know scholarships existed, for postgrad. So I looked it up, and apparently there was a doctoral scholarship for Otago Uni, which basically meant that you don't pay tuition, and you get $25,000 per year for living, which is tax-free. So, either paying 50 grand a year in Queensland versus receiving 25 grand a year in New Zealand. Multiply that by 3 years, you don't have to have an MBA degree to understand.
Yes. I mean, the reason why I ask is because for many graduates, they reach a point now in their career when they're maybe 3-4 years out, and they're thinking about, do I specialize? And like you, in your situation, they might have a significant other that they might not be in dentistry and might not be able to understand. And so for someone that's gone through it, that's why I asked you that question,
Look, my wife, she is my rock. And, we've been together for 20 years. We started dating when I was 21 and she was 18. And you really do need the support of your partner, because these are crazy times, and your income plummets while you're doing the training. And I don't even think, after being in general practice for quite a few years, if you think of specializing, financially you might not recover from the income summit, because basically, instead of earning $200,000 a year, you kind of go to chewing through your savings. So, you know, but it's not about the income. Even if I mean, you need to like what you do. So when you wake up in the morning, I mean, it sounds really, meme kind of thing, but you need to enjoy what you do. So, I mean, if you hate, if you, sorry, I shouldn't have said that. If you get to a certain point in your career that you see that you're really, really not enjoying certain parts of your work, and you're really, really enjoying the other parts of your work, you kind of need to make up your mind whether you want to concentrate um, on certain things more. And you don't necessarily have to specialize. You can take courses to get you more knowledge in a certain field. It's like with medical GPs, you have GP with interest in whatever, special interest in something, in women's health, mental health, minor surgery, skin cancer, whatever. But they're still GPs. They're not gynecologists, they're not psychiatrists, they're not dermatologists or whatever. But they they expand a certain field of their practice by doing more training in that field. So yes, specialty does take a toll. It is fun. It is heaps of fun. It's tough, but it's awesome at the same time. But some people cannot do it for certain reasons. If they have family commitments, or partner that is not super supportive, or financial reasons, or whatever. It doesn't have to be a full-blown specialty spread over 3 years. It can be courses in a certain field, and especially if you work in a um, not in a solo practice, but like in practice with several providers, you can actually become your practice's so-called specialist. So if you do more ortho, you can. I know plenty of dentists that limit practice to ortho. You can limit your practice to whatever you want to within that multi-person practice. So they just offload some of their cases in that particular field to you, which is fine as well, even without holding the specialist degree.
Yeah, I mean, I think this is where the term, a general dentist with special interests in something in particular comes about, yes. Or the term super GP gets thrown around. So let's talk about your ideal clinical or non-clinical day. What does it look like in 5 years' time? And, what kind of courses do you want to be taking to kind of get you to that point?
Um, I think there are a few courses that I would like to take. One of them would be zygomatic implants, which I'm not sure that I'm going to implement, because I have a lot of reservations being a perio for all on X type of treatments, when one of the requirements is removing a shitload of bone, and in perio we count bone in millimeters, not in centimeters. Um, it's like I picture it. So yes, I would like to get some training in those areas, even though I might not implement them, but to expand my knowledge. Uh, I I will do more courses provided by international educators about more advanced grafting procedures or soft tissue surgery. Once the borders open up, if
Mm.
they ever open up. Um, so, you can always do better. Whatever you do, you can always learn more because there are always people around that know more than you do. And you might not become like them, but you become better than you were a year ago, which is
Yeah, I think you talk about an interesting point here. You talk about, you're running your own race and you're just learning from the people around you. You don't have to compare yourself to the best clinician. There's always going to be someone better, but the thing is, you're making these incremental improvements along the way, and that's the most important.
Absolutely.
Yeah. So we've got a quick question. Some people is asking, do you have the "Be nice to me, you may need implants someday" shirt going on right now?
Yes, I do. If I find it, I will look up in the laundry. I'll take a picture of it.
Yes, well, some of our viewers are wondering if you're wearing it on at the moment, but
no, at the moment I'm my scrubs.
So, Dr. Leo Lando, there's so many more questions I want to ask you, but that's all the time we've got for today. Thank you for coming on the show. If you could let the people know how they can find you or what's kind of going on in your life at the moment.
Well, basically, the next thing that was supposed to be going on in my life is doing my no-tooth area in Canberra, which is not going to happen, unfortunately, with all the board restrictions. So I just put a post on DPR that we have to postpone this. And this is really unfortunate because I've been planning that for a few months now. So as soon as the regulations would ease, we will be back doing that. And I really like to teach, even though English is not a language. It's not easy to talk 7 or 8 hours. But it's kind of perio, as you said, it's not very well as the unit, so it's really a shame. I'm trying to change that few people at a time. So hopefully we'll be able to do that sooner rather than later. The ways to find me either on PTR, on Facebook, which I'm probably addicted to. If you want to, if you live in South Australia and you would like to chat with me over a coffee, find me up on Facebook, send me a message, or on Instagram. If you want to refer patients to me, let me know. I will get my receptionist to send you a referral.
So, for our viewers, if you like this episode, drop a comment below on your favorite part, but don't forget to like and subscribe. For our listeners, if you like this episode, leave a review as well, and don't forget to share it with your friends. And we'll see you on the next episode at CPD Junkie Podcast. Dr. David Lano, have a good night.
Thank you so much for having me.